With October being Breast Cancer Awareness Month, we wanted to talk about some common breast diseases that women should be aware of. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Ashley Marumoto, breast surgeon at the Queens Medical Center. Good morning, doctor. How are you doing this morning?
Excellent. Good morning, Ross. Thanks for having me.
Now, first off, what are the current screening guidelines for breast cancer?
Thanks for asking. Current screening guidelines recommend that women begin screening with a mammogram at age 40. However, there are some groups of women that require screening before this, and that's women with high risk of developing breast cancer if you have a strong family history or a certain genetic predisposition. Certain people who have received radiation before in their lifetime also need screening earlier than the age 40. We have a high-risk clinic here at the Queens Medical Center who can help assess your risk of developing breast cancer and if you qualify for high-risk screening or early screening. Sometimes patients can get breast MRI as well, which is supplemental to their screening mammograms, and that's beneficial for high-risk patients. Also to know, there's really no age designated at which screening should stop.
Now, doctor, when should a patient get referred to a breast surgeon?
That's an excellent question. So anytime a patient has a symptom in regards to their breast, they should undergo a workup. And that could include something like a mammogram or an ultrasound. And that could be performed by any physician. But if there's any abnormalities seen on imaging or if symptoms persist, that could certainly be referred to a breast surgeon for further evaluation. Other things could include like a persistent rash on the breast or nipple discharge, breast pain. Additionally, lesions can be benign in the breast, something like a fibroadenoma, but if they're symptomatic or growing, then that could be referred to a breast surgeon to consider excision. Anytime there's an abnormal lesion that's biopsied or suspicious on imaging, like abnormal cells such as a tibia or precancers or malignancies, cancers that get diagnosed, that should be referred to a breast surgeon too. Anybody with a high risk of developing breast cancer, like a genetic predisposition, perhaps you've heard of like BRCA genetic syndromes, that should also be referred to breast surgeons to discuss a prophylactic surgery or preventative surgery.
And doctor, lastly, once someone is diagnosed with breast cancer, what is the treatment plan?
The treatment plan is often multimodal. So a breast surgeon is involved, a medical oncologist is involved, and a radiation oncologist. And the therapy also often involves some combination of those three things. Sometimes chemotherapy or systemic therapy comes before surgery. So it's really important to talk to your physician about what type of breast cancer you have, because the treatment algorithms and options really are personalized these days with all the research going on.
Now, to learn more about breast cancer, you can join Dr. Marumoto for the Queen's free virtual Speaking of Health lecture. That's coming up on Thursday, October 20th from noon to 1 p.m. To register, you can visit www.queens.org/events, or you can give them a call at 808-691-7117. Thank you very much, Dr. Marumoto, for your time, and have a great day.
Thanks, Ross. Appreciate it.